Good afternoon, everyone, and welcome to today's webinar, Federal Support for Behavioral Health and Justice Responses, Best Practices, Resources, and Education, hosted by the Bureau of Justice Assistance. At this time, it's my pleasure to introduce one of today's speakers, Maria Fryer, Policy Advisor with the Bureau of Justice Assistance, to start us off today. Maria.
Thank you so much, and a big welcome to everyone. I'd just like to say again, thank you for joining today's webinar as a part of BJA's webinar series, the FY 2022 Federal Support for Behavioral Health Responses. And we are your hosts, Maria Fryer and Tim Jeffries, as we oversee a number of behavioral health programs and policy work in the policy office at BJA. We are so happy to be with you here today, and hopefully to provide you with a lot of helpful information regarding FY 22 programs offered through BJA. So we're going to begin with today's agenda. And for today's agenda, we will first provide you with an overview of the Office of Justice of Programs and the Bureau of Justice Assistance. Then I will pass the presentation over to my colleague, Tim, who will provide you with a brief description of the problem and introduce you to a number of programmatic solutions. We will then provide you with an overview of BJA programs and program funding. Next, we will review a number of resources and tools for grant applicants. And last, conclude with Q&A sessions for the policy and with the policy staff who oversee and manage specific programs. They are here to answer your program-specific questions. I'd like to just first note the following disclaimer here at the bottom of the agenda, just to let you know that all grant program plans and forecast data provided by the U.S. Department of Justice are subject to the availability of appropriations and potential legislative changes or statutory requirements. The information provided by DOJ is based on projected operational plans and may be updated frequently, including the addition, substitution, or cancellation of projected solicitations without advance notice. Grants.gov provides an email subscription service upon request to send notifications when solicitations are officially released. So what is the Office of Justice of Programs? The Department of Justice is committed to advancing work that promotes civil rights and racial equity, increases access to justice, supports crime victims and individuals impacted by the justice system, strengthens community safety and protects the public from crime and evolving threats, and builds trust between law enforcement and the community. Within DOJ, the Office of Justice Programs supports communities to successfully design and implement best practice programs and evidence practices to achieve these priorities. BJA supports this goal by strengthening services to victims, advancing collaborative approaches to behavioral health, implementing state-of-the-art strategies for crime control and prevention by law enforcement officers in states, cities, and neighborhoods, and also by expanding research, training, and technical assistance to inform programming and improve and enhance service delivery in communities. BJA is proud to support our nation's state, local, and tribal criminal justice agencies with the express purpose of reducing crime and strengthening communities. One of the most important ways that we do this is by providing grants to agencies and communities in order to support local efforts. We do our best to design programs that are responsive to real-world challenges and provide maximum flexibility for local implementation. BJA is committed to streamlining the application process and minimizing the administrative burden of managing our grants. We've made real progress in recent years and continue to make grant funding more accessible and easier to manage. In other words, we would like smaller agencies and rural agencies to not be intimidated by this process or think that they must have an experienced grant manager to successfully apply for BJA funding. If you have the desire to apply, we have the support and we are here to help you succeed. It is, however, important that you don't procrastinate, of course. Once the solicitation is open, there's a lot that has to be done on the front end to apply. Waiting until the last week to apply may not leave you enough time to gather the necessary information needed for the application, and we want you to succeed. And so to do that, you must apply as early as possible. So types of BJA grants. There are two types of grants, discretionary and formula. The discretionary grants applicants apply directly to OJP and BJA, and these grants are typically competitive and awards are based on a predetermined review process and availability of funds. For most programs, we receive more applications than we have actual funding for, so we try to fund the strongest proposals based on objective review criteria. Formula grants are typically awarded on a non-competitive basis, which usually means that every eligible applicant receives some funding. The amount of funding for a specific agency or jurisdictions can vary based on a variety of factors, which often include population and crime rates. Most formula grants are administered by the State Administering Agency, or SAA. If you don't have an active relationship with your SAA, start one today. If you don't know who your SAA is, you can find a complete contact list on our website. We will soon talk about 2022 funding opportunities and provide a brief overview of each. But first, I would like to introduce you to my colleague, Tim Jeffries, on the next slide, who's going to introduce you to our topic for today. Okay, Tim.
Thank you, Maria. That was a great introduction. I'm Tim Jeffries. I'm a senior policy advisor within drug policy, and I have a degree as a master's of social worker. And that just really means I spent a lot of time, significant time, working with incarcerated children prior to working with the federal government. It means that I get it, right? So there's many wraparound services and resources that are needed in addition to criminal justice related treatment services that we offer to think about, right? So why are we here today? First off, I want to think about encouraging you to look at operationally defining what we mean by behavioral health. And before we do a deeper dive into what we call our BJA behavioral health related programming, I want you to hear that we'll discuss things around the sequential intercept model, right? If you haven't been familiarized with the sequential intercept model, it just means that we looked at ways that any intercept point of the criminal justice system where someone with a SUD, substance use disorder, may be involved and thus able to provide an intervention. The term behavioral health in this context means the promotion of mental health, resilience and well-being, and treatment of mental health substance use disorders, as well as support for those experienced in recovery in these conditions. This is coming from the SAMHSA definition, by the way, and it also includes providing support for families and communities. And this means ensuring those being released from the criminal justice system not only are what we could consider sheep amongst the wolves, but we're going beyond that and making sure that they are prepared for community reintegration and successful reintegration back into the community. And I really also want to stress the importance of recovery to this piece, because from these conditions, often it's the importance of recovery that's not necessarily considered, right? So we want to make sure we're equipping our people and our customers with necessary community resources, which includes housing and supporting supplemental needs as well. So as you're thinking about a brief descriptions that we're going to talk about all of the behavioral health related programming today, or what we've also heard them called as notice of funding availabilities or funding announcements. Just be thinking of other ways that you could request funding in these areas to support additional resources in your community, and that does include training and technical assistance. So this leads to a discussion around also other areas in the criminal justice system that we'd like to be involved with. So when we're talking about significant health needs, these are areas that are affected in all of the communities that we've seen within the criminal justice area that need behavioral health interventions. So severe substance use, chronic medical conditions, and also infectious diseases are things that we need to consider. Also, high risk of recidivism, which includes rearrests, reconvictions, revocations, and also reincarcerations. And as a result, in your community, you'll see a higher cost, especially when it's pertaining to disproportionate healthcare costs and criminal justice spending. So thinking about a solution to these situations, because that's why we're here today, BJ aims to provide additional funding and support around behavioral health related programming and to reduce things like homelessness, also constant recidivism or reentry back into your criminal justice system, as well as multiple encounters with law enforcement where we've seen with those who suffer from opioid overdose, which, as you know, is about 100,000 people who died from opioid overdose just in the last year alone. So the good thing is that most of the behavioral health funding streams are bipartisan supported by Congress, and they've also recently received increases in appropriation by FY22. So now I'll turn it over to Maria to discuss the behavioral health programming needs.
I'm going to begin right here with improving substance use disorder treatment and recovery outcomes for adults in reentry. So looking at this program is for people who are reentering the community from prison or jail. And of course, as you know, this population faces many challenges to stability in the community. And planning for reentry really begins, especially for people with perhaps mental health disorders or co-occurring mental health and substance use disorders, really begins long before release. Where there is a need to be connected to treatment providers in the community, it is even more critical that case management be involved and a strategy to be in place prior to release. And this program is to improve and enhance corrections and community-based providers' ability to address substance use disorder treatment and recovery needs during incarceration and reentry. So, as you can see, BJA expects to fund approximately 8 awards, and the eligible applicants are government entities, tribal governments, nonprofits, and institutions of higher education. Please visit the National Resource Reentry Center for a one-stop shop for best practice tools. The one you see above is just one example of many resources to guide practitioners and program managers as well as administrators. The next program I'd like to talk about is the Collaborative Crisis Response and Intervention Training Program. This program enables law enforcement and corrections entities to educate, train, and prepare staff to respond appropriately and interact effectively with people exhibiting mental health disorders or who may appear to have a mental health condition. Similarly, ensure that law enforcement and corrections are equipped to safely and effectively work with people having intellectual, developmental, or physical disabilities. This program supports the development of model responses that incorporates BJA's Crisis Response and Intervention Training Program curriculum and additional best practices designed to increase understanding of behavioral health conditions and disabilities. Applicants are encouraged to use BJA's curriculum as the foundation of their training efforts, and this training curriculum should be made publicly available by the end of fiscal year 2022. So a little bit about the award itself. There are 2 categories, and the first category is for law enforcement and deputies who are out in the community and are functioning in a law enforcement capacity and public safety and public health capacity, as well as the second category for correctional officers and for those that are operating in a correctional facility or in a correctional capacity. This program is supported by the Academic Training to Inform Police Responses, and this is a national initiative to support these grantees and site-based programs. And although it says police responses in the title, a best-known secret of this training and technical assistance is that it also supports correctional responses and responses to people with developmental disabilities. So a lot of people don't realize that, but there's a lot of resources. And you can visit the website on the slide, and there's more resources and description about this program there. And especially, you can learn more about the different model responses, such as crisis intervention team, co-responder team, law enforcement-based case management services, law enforcement-assisted diversion, mobile crisis teams, crisis resolution and home treatment teams, and EMS and ambulance-based responses. So now I'm going to turn it back over to Tim, and he is going to talk about the COSSAP program. Tim?
Thank you. I appreciate that, Maria. And for those of you who don't know COSSAP, what we call COSSAP is Comprehensive Opioid Stimulant and Substance Abuse Program. You may have formerly heard of it as COPE, which was Comprehensive Opioid Abuse Program. It's how it started about 5 years ago. It's one of the largest discretionary grant programs in BJA. Of the 56 or so programs that we're going to announce this year, The good thing is that the appropriation is about $185 million. That's quite a bit, right? And last year was the same, roughly around the same appropriation amount, which does not include PDMP, Prescription Drug Monitoring Program, which we'll talk about at a later on point of today's webinar. But also it loops in all of the funding under CARA, which is Comprehensive Addiction Recovery Act, and other programs which you'll hear from today. So COSSAP funding is made available, and we talked about the sequential intercept model in any area to support criminal justice substance use related programming in any area, whether it's diversion, whether it's pre-arrest, whether it's prisons and jails, or peer recovery support services, community reintegration areas. So anywhere along the sequential intercept model is funding available for those particular programs. Just out of a point to note, last 2 years, what we saw primarily the funding request for MAT, which is medication-assisted treatment, as well as law enforcement diversion programs, law enforcement assisted diversion programs. Here you'll see that the category 1, we broke it down to 2 categories. One is state-based funding, up to 10 awards, and that's up to $6 million. We hope to support multiple different jurisdictions or cities or counties within that state with that amount of money. And the second category 2 is for local site-based jurisdictions. The maximum is up to $1.6 million, and that will be dependent on your jurisdiction size, right? So if it's a smaller jurisdiction, the maximum you can receive is less funding for that. Similar to the other programs, eligibility is for state entities of government, cities or townships, as well as Native American tribes, and we'll discuss tribal-specific applications also later in another appropriation or solicitation that we have available. And we also have the link to the funding area under BJA, and it's an opportunity to see some prior years' successful applications that we posted that are available for you to preview and see if it's something similar to what you would like to do in your program. Next, we have the Prescription Drug Monitoring Program. I mentioned that that was previously under the Comprehensive Opioid Stimulant Substance Abuse Program. It's a separate solicitation now. It's designed specifically for data collection and also dissemination and information around data hubs. And we'll get to some more information about that as well. The maximum number of awards, we're projecting 16 to 20 site-based awards, as well as a $1.4 million max for that. $31 million is the amount, the appropriation for this year as well for PDMP. Here are some great resources. We have what's called TTAC, which is the Training and Technical Assistance Center for PDMPs, and we encourage you to look at some of those resources there as well. And now at this point, I will turn it over to Maria for Connect and Protect.
Wonderful, thanks, Tim. The Connect and Protect is a newly launched program as part of the Justice and Mental Health Collaboration Program, or otherwise known as JMHCP. It is specifically geared towards law enforcement and provides funding to state, local, and tribal governments to improve law enforcement and community responses to people with behavioral health needs. It aims to reduce unnecessary law enforcement contact and connect people to needed treatment and support, such as what Tim just mentioned, MAT, like medication-assisted treatment, needed for people with co-occurring mental health and substance use disorders. It's important to note that collaboration with a mental health partner is required through an MOU for this program. Yeah. My slides aren't changing. Sorry, let's see if we can get this to move. There we go. Okay. In FY21, this program made 36 awards over $18.2 million. The award amount is the same this year as in FY21 at $550,000. Example model programs include co-responder teams, crisis response teams, mobile crisis teams, intensive case management, or law enforcement mental health integrated 911 dispatch. And here we have on the next slide, this slide, some resources for you. The Police Mental Health Collaboration Toolkit is a resource to help agencies and their behavioral health partners to learn about, plan, implement, train, manage and measure and deliver behavioral health programs. For new law enforcement behavioral health response programs on the Police Mental Health Collaboration Toolkit, sites can take a police mental health collaboration self-assessment and learn where they are in terms of implementing a fully planned response. Agencies can also request free peer-to-peer learning with one of BJA's 14 law enforcement mental health learning sites. And there's also opportunities for hands-on learning with law enforcement and behavioral health partners on strategies to respond to people with behavioral health needs. Here are some additional publications to note. And the next program I'd like to talk about is the School Violence Program, School Stop Violence Program. The STOP program trains school personnel and educates students to prevent violence and strive for a safe learning environment. In FY22, STOP also provides specialized training for school officials in responding to mental health crises, and also understanding bullying and interpersonal violence and how it affects the school environment, and also efforts to improve how to improve the school environment using technology. This is a very large program with approximately $49 million available for site-based awards. It's important to note that eligibility includes independent school districts such as charter schools, nonprofit and private schools, and institutions of higher education. STOP has many uses, such as training school staff, hiring and supporting personnel, paying experts to deliver best practice programs, deploying anonymous reporting technology, and making subawards as needed through the program. Careful considerations for STOP are that the program may not hire new school resource officers or SROs, but it can pay for overtime for existing SROs. And also it may not install deterrent measures considered target hardening, such as cameras, metal detectors, or ballistic glass and other types of equipment. STOP program resources. We'd like you to please check out these STOP resources, such as the National Center for School Safety, best practices for behavioral threat assessment, and trauma-informed approaches. And now I'd like to turn it back over to Tim.
Thanks again, Maria, thank you. And I'm Tim Jeffries once again, and I'm going to talk about coordinated tribal assistance solicitation. Through CTAS, BJA, and a few other grant-making components within OJP have provided a coordinated application process for federally recognized tribes. And this makes it easier for tribes to apply for funding across a myriad of different bureaus. So within the BJA area, we want to discuss or focus specifically on purpose areas 2, 3, and 4, which support comprehensive strategic planning, also to address programs with adult tribal justice systems from prevention and treatment to tribal courts, as well as corrections and reentry, and strategies to address violent crime and also support tribal justice infrastructure. And also this is through renovation as well as modular buildings. Here you have information on the CTAS program resources. I encourage you to look back at these once you get a chance. And also now I want to shift gears quickly to the Family Treatment and Juvenile Office of Juvenile Justice and Delinquency Prevention. So this area is not under the Bureau of Justice Assistance, but as we mentioned before, we partner with other entities. So the Office of Juvenile Justice and Delinquency Prevention receives funding under the COSSAP portfolio, and part of that is to support family and juvenile-focused drug courts. That's an appropriation amount under the COSSAP umbrella. So in this area, there will be funding available for courts under juvenile treatment courts, as well as family treatment courts and juvenile tribal healing to wellness courts. Here we expect to receive up to 50 applications in 2022 with a $20 million appropriation for funding. And lastly, we want to provide some resources under juvenile drug treatment court, as well as family treatment court and juvenile tribal healing to wellness court services. And now I'll turn it back over to Maria.
Okay, great. I'm getting a little faster with mute and unmute. So this is the Kevin and Avante program. known as the Reducing Injury and Death of Missing Individuals with Dementia and Developmental Disabilities. And this program supports local jurisdictions' efforts to reduce the number of deaths and injuries of individuals with Alzheimer's disease or developmental disabilities, such as autism or Down syndrome. And it supports locative technology and training to aid in the rescue of people who may leave a safe environment and potentially be at risk of harm. The program is implemented with technical assistance through the Home Safe Initiative and is based on best practices, deployed in a person-centered and least restrictive environment. The program's history and development arrived out of the need for public safety and community partnership interventions for people who wander, just as these two young boys did, Kevin Curtis and Avante Aquento. This program has a limited amount of funding, but is making huge improvements in the disability community, as it's been just long needed in terms of public safety. It has last year up to 13 awards. Currently the amount is up to $150,000 each. There are 2 categories. It includes, category 1 includes healthcare and nonprofits, and category 2 includes healthcare and governmental agencies. Here is the link to the Home Safe website. We encourage you to visit this website for additional information and resources. So the next slide is about the Justice and Mental Health Collaboration Program, a flagship program in terms of behavioral health responses. And this program provides funding to state, local, and tribal governments to improve responses to people with mental health disorders and co-occurring mental health and substance use disorders who have contact with the criminal justice system. The funds, they span all stages of the criminal justice system, from initial contact with police through jails, courts, corrections, and reentry. It requires a criminal justice collaboration with a mental health partner through an MOU, and brings service providers and criminal justice stakeholder groups together to conduct system mapping, just as Tim mentioned, through the sequential intercept mapping, gap analysis, and other activities to better understand how people with mental health disorders and mental health and substance use disorders flow to and from the criminal justice system. And it helps to implement best practice programs that keep people connected to treatment and out of the criminal justice system. JMHCP has funded 600 entities across the nation, representing 49 states and 2 U.S. territories. Thus far, over $200 million awarded. So how does JMHCP support communities? It supports communities by raising awareness of the issue, providing direct consultation support, and disseminating best practices widely. Some example program types are things like crisis stabilization units and pre-arrest diversion, post-arrest jail diversion, mental health screening, assessment, and treatment in jail, and mental health courts, community corrections, and specializing in mental health caseloads. And here I'd like to highlight just a few resources and policy briefs that can help you as you plan, and along with a few examples of some of the programs that I mentioned. So this next slide is about the national initiatives, Justice and Mental Health Training and Technical Assistance, because this year BJA will recompete this National Justice and Mental Health TTA initiative. And it is open to a wide variety of agencies who may have the capacity to serve jurisdictions on a national level with expert training and technical assistance. This TTA program will provide expertise to grantees who receive site-based awards, such as JMHCP, Connect and Protect, and other law enforcement behavioral health responses, Kevin and Avante, and the Crisis Response and Intervention Training Program. And BJA will make the award in the form of a cooperative agreement, where the recipient will work closely with BJA to accomplish its mission of increasing services, partnership, and reducing recidivism, as well as responding to people with disabilities. There are 5 categories Solicitation will include 5 separate categories for multiple justice and mental health programs. And each category is seeking applications for a separate national initiative. Applicants can apply to more than one category, but they must submit a separate complete application for each. And now I'd like to hand it back to Tim, who's going to talk about the RSAT program.
Thank you, Maria. And I know justice and mental health collaboration is extremely important based on the number of co-occurring substance abuse and mental health folks that are out there within the CJ system. So thank you for that work. I'm going to cover now residential substance abuse treatment programs, and that's a formula award. It's a little different from the site-based discretionary grant awards that we've talked about in the past. This area is to support states, and usually out of the Department of Corrections or Department of Public Safety, as well as tribes for substance abuse or substance use disorder-related treatment within correctional facilities. Also, a portion of this funding is made available for community reintegration, as we talked about before. There's a slight uptick, just wanted to mention, in the appropriation. We talked about that prior, so there's about $40 million available for those states. So that's why we show that it's about 56 awards that are made available to each state and territory. So with that increase, it looks like about average approximately $540,000 per each state and territory. That's on the average. Here's a great resource. We talked about promising practices. If you're not familiar with that, that's what's the evidence that shows of what works within RSAT programs, as well as the other two resources you have listed, the compendium for RSAT programs, listing and mapping out where they are and what types, as well as the program's RSAT training and technical assistance website. The other solicitation that we want to bring to your attention, similar to the one that Justice Mental Health Collaboration is going to recompete for the training and technical assistance arm, is our RSAT Substance Abuse Training and Technical Assistance Program, right? So we suspect that there are approximately about three applications will be made available, and we have about $1.2 million available for those awards. So if you're not familiar with that process, that is an annual appropriation, and a percentage of the appropriation is made available for TTA. So that's a ballpark figure of what's available under training and technical assistance. This responsibility is to maintain the website and also to provide on-site and off-site and telephonic training and technical assistance, and to have an overview of all of the 56 state and territory training and technical assistance needs for RSAT. Here's a great list of resources for training and TA, also pointing you back to that website that I mentioned that houses an overview and summary of all of the RSAT-related programs and the best practices. We're getting close to the end. I know it's a lot of information, so if you guys are getting a little exhausted, please, if you do nothing more than think about the resources that we have attached to the pages, and then you can go back later at another date and kind of get an idea of what's specific to your behavioral health needs. So I want to talk next about drug court discretionary grant programs. These are one of the longest rigorously reviewed and tested and evaluated programs that we have since 1989. They are designed to do alternative to incarceration and court programs, which require mandatory drug testing, sanctions and incentives, and transitional services under a court, judicially supervised court setting for predominantly high-risk, high-need defendants. Under this solicitation, this also received an uptick in funding from last year. We're expecting about 72 applications to come in under this year with an $83 million appropriation. As you see, there are 3 categories. Category 1 is for planning or implementation. We expect about 11 awards for that, up to $700,000. Category 2 is enhancement of estimated 26 awards that may be available for $750,000. And category 3 is a statewide for an estimated number of 8 awards. So states applying on behalf of locals, up to $2 million is available. So eligibility is different depending on the type of category, but you can see the types of eligibility for a unit of government, whether it's state, local, county, or tribal entity of government for these as well. Lots of resources on this page. You have NDCRC, National Drug Court Resource Center, as well as drug court best practices standards, promulgated by National Association of Drug Court Professionals, as well as the 10 key components and other essential elements of opioid courts and drug courts. Great resources to check on later. And then one of the newer programs I want to mention, this is a separate solicitation under VTCs is what we call them, Veterans Treatment Courts. They're generally the same type of setup as the Adult Drug Court Discretionary Grant Program, where evidence-based integration substance use disorder is relevant, as well as mandatory drug testing, sanctions and incentives, and transitional services, once again, for community court order supervision. The only difference is this is through a support services for veterans, it has to be for veterans, and traditionally there is a history of violence and PTSD, which is post-traumatic stress disorder, as a result of their military service. I also believe that there was a change in the authorizing language in this legislation change that reduces the violent offender clause, so you might want to look for areas or opportunities to add more clients into your program under that separate solicitation. There's about $25 million available for that, and under the 3 categories that you see here, similar to the Adult Drug Court Program, one is for planning and implementation, up to $700,000, looks similar to the Adult Drug Court Program. Also enhancement, once again, enhancing an existing drug court program that you have. There are about 14 wards that are projected for that. Once again, these are for VTCs, and also at the state level for $2 million to support multiple programs, multiple VTCs within your state. Here's some great resources, once again, coordinating with multiple training and technical assistance providers under Justice for Vets, as well as the 10 key components for Veterans Treatment Courts. Great resource, and drug courts review, which is an annual review completed by the training and technical assistance providers as well. So we know we talked about a lot of opportunities for you. This is just a small snapshot of the behavioral health portfolio within the bigger 56 or so programs that BJA operates, but we hope that we've not exhausted you and provided you with some great opportunities for future funding and to look at any areas and gaps in service delivery and request funding around those gaps. So I'll turn it back over to Maria for the final stretch.
All right. Well, thanks, Tim. So this is the part where we conclude the portion of the presentation that pertains to the specific BJA programs. And now we have to roll up our sleeves and talk about the application process. So that's really an important part of the presentation. We want to continue to briefly provide you with some general and additional resource information to further assist your needs. So let's go ahead and do that. While we did not discuss all of the TTA opportunities in today's presentation, since some are not really funding opportunities that you can apply to, but please keep in mind that the vast majority of our competitive grant programs have a correlating training and technical assistance provider, or TTA provider as we refer to. And among various services, the TTA providers assist grantees with achieving their project goals and performance measurements, provide information on lessons learned from the field and other grantees, and other invaluable resources. We previously noted that some solicitations have been posted for the field. However, for those solicitations that have not been posted or released yet, please note that the solicitation release dates are still pending and many are on a rolling basis. So to stay abreast of when those funding opportunities will be made available, it suggests that you subscribe under the BJA website in order to receive electronic email notifications or funding opportunities and other significant BJA news and resources. So we will provide the official BJA web link shortly on one of the forthcoming presentation slides. In relation to the application submission deadline, we typically post our solicitations for at least 60 days. However, this time frame may vary from one solicitation to the next, and may be posted for either longer durations or shorter durations. So it's really important to read the fine print. Okay, now let me advance. Here we go. Okay, so we're just going to go ahead and get into some of the resources. First, I'd like to talk about grants.gov, which provides training and technical assistance, mostly technical assistance, with getting started. However, they do have a lot of sort of self-paced information and webinars in submitting the application for federal assistance, the SF-424, and on the site there are Grants 101, how to apply, and other helpful listings. Next is Just Grants, customer support hotline and email. Notice the slide here states submitting the full application in DOJ's Just Grants system. And that is because there are two steps in the process. One is with grants.gov and the second is with Just Grants. And I just want to make sure that I say that because we're going to review this again, but it is so important that I thought I should just say it twice. So I did. All right. Application assistance and support. So two resources here. General assistance from OJP, which are for general questions, maybe not Just Grants specific questions, and the funding news email subscription that I mentioned at the beginning of this section, Just Info newsletter and subscription for notices. Okay, resources for FY 2022 grant applications. All of these can oftentimes be referenced throughout the life cycle of the grant or the performance period of the program. Specifically, the DOJ Grants Financial Guide and also the requirements that are under DOJ Grants Financial Management online training, which is normally due within 120 days of receiving an award. But go ahead and take a look at these when you have a chance. They're just super important resources. BJA Grant Application Education Series. Here is another resource that enables you to access previous webinar recordings, transcripts, and slides. This could include this webinar once it's concluded and archived, in addition to other recordings that may be of interest to you and your colleagues as well, especially for teammates that may have missed today's presentation. Okay, become a peer reviewer. OJP and BJA are always looking for new peer reviewers to provide their expertise and help OJP expand its peer review database. And so if you're interested, then please examine the information here on the slide, send to the email address provided. We thank you in advance for your participation and partnership in the peer review process. It's very important to have a competitive process, and we need people with expertise to participate. At this time, I will go ahead and continue with the last, I think we're at the last slide finally. Oh, no, we've got a few more. Okay, so this one is the most important reminder. This is the one that I said is worth mentioning twice. There are two steps to submit a full application. The first one is to submit the SF-424, which is the application for federal assistance in grants.gov, which is the first deadline. Then the second deadline is to submit the full application, which is the rest, the abstract, the narrative, the budget, and all of the required attachments that you find in the solicitation that go in Just Grants. So please note that it's a two-step process. There are two separate deadlines in two different locations, grant.gov and Just Grants. And please note that the deadline this year is different from last year. If you look at the time, it's 8:59, not 11:59 Eastern Time. So please make note of that. Stay connected. These are good places for additional information on just what's happening across federal agencies, but specifically with this application process. So you can subscribe, you can connect to social media, or you can go to bja.ojp.gov. Okay, so for quick reference, the technical assistance with submitting the SF-424 in grants.gov, contact grants.gov customer support hotline, 1-800-518-4726. For technical assistance with submitting the full application in DOJ's Just Grants system, contact the Just Grants Service Desk, 833-872-5175. For assistance with unforeseen grants.gov or Just Grants technical issues beyond an applicant's control that prevent it from submitting its application by the deadline or any other requirement for the solicitation or all solicitations we talked about, contact the National Criminal Justice Reference Service, NCJRS Response Center, toll-free number 1-800-851-3420. And last, number 4, applicants must register with grants.gov prior to submitting an application. All applications are due 8:59 Eastern Standard Time. So there we are. I think we have about 10 minutes left for questions. I'm going to go ahead and hand it over to our see what we have in the Q&A.
Great. Thanks, Maria. Thanks, Tim. Very well done. There was a lot to get to there. Before we get into the Q&A, just want to remind everybody that the PowerPoint recording and transcript for today will be posted to the BJA website. So definitely keep an eye out for that. You'll be able to go back and reference what was discussed today as needed. So the first question, can you restate what changed with the VTC grant eligibility and what other grant you said may be an opportunity if there are participants without a history of violence?
Yeah, this is Greg. I oversee the adult drug court, and I used to oversee the veteran treatment court program. So like Tim mentioned, we do have two separate solicitations. In terms of the VTC, VTC is unlike the VTC solicitation is unlike the adult drug court solicitation, which has a prohibition against violent offenders. So when Tim was mentioning that with the VTC solicitation, which will be being released pretty soon, does not have that same violent offender prohibition, which means through the VTC solicitation, you can request funds to support veterans who have a history of violence. Thank you, Daryl.
Are profit treatment centers eligible for the COSSAP program?
This is Tim. Profit aren't, but we often encourage them to coordinate with their local unit of government, whether it's the health department of the county or the city, or any entity of government, the sheriff's office, public defender's office, whether it's the county, health department. I'm not exactly sure which profit agency they're looking at, but often they are contracted to do treatment services or community reintegration services or supportive housing initiatives, and that's where you would see them written in as a sub-grantee from the entity of government.
Great. A couple questions on release dates. Obviously, specific dates are known for some. Currently, items are being released, and the general purpose for that one slide was May through June was the general release dates. Is there a latest month that a grant would be announced? Would it go past June, just with the fiscal year ending later in the year?
This is Tim again. Our plan is to get them out as soon as possible. I believe the adult drug court solicitation was announced yesterday, and it'll be a week right now that the systems are down, but in the early April, first or second week of April, we're looking to get out as many of those 56 program solicitations on the street as possible.
And Greg, thanks for answering this in the question box, but I will ask it verbally just so it could be transcribed in the transcript. Will the adult drug court discretionary grant allow for continuation funding, or is it only for new positions?
So the adult solicitation, 48-month period of performance. The continuation, I'm not quite sure I understand the continuation aspect of it. If you do have currently have an active adult drug court program funded through BJA, you may apply for another one as long as the current or active award would be ending during the start of the new award. Let's see, I know there's another part of that question. And in terms of one of the allowable use of funds would be expanding the capacity of program, and that would be if you're looking to hire staff, whether it's a case manager or a treatment professional be a part of your program, or any parts of any other staff, you would be able to use that funds for the adult drug court solicitation. Thanks, Daryl.
This one attendee was wondering if the 5 TTA awards under the JMHCP program could be repeated or just discussed in a little more detail. And I could put that slide up if you want to mention
that would be great.
Do you know which one it is by chance, Maria?
I'm trying to find it. It is a large pile of slides. Go ahead and if they would like to reach out to me after the presentation, I would be happy to provide further information. Or if you want to go to the next question, I will go ahead and gather up that information.
Yeah, we can go back to that and I can pull that slide up for that person. Problem.
Okay.
For the adult drug court discretionary funding statewide track, can a state agency apply on behalf of an existing drug court network that may or may not already receive BJ funding or expansion funding? Or would that track be for implementation funding solely?
Yeah, thanks, Daryl. So if you're applying for through the adult drug court within Category 3, which is statewide, you would be able to request funding if the state, obviously the state is the only eligible applicant. By that state being the fiscal agent, they would be able to write within that application any partnerships that they have with any local drug courts that are not currently receiving BJ funding, which means they would be able to write in their application. And we see this in past applications where they may indicate 5 other adult drug courts throughout the state that they're looking to support with the statewide funding. And it doesn't necessarily have to be implementation or enhancement. It can be both. If they're looking to help a individual adult drug court or helping a court start a new adult drug court, or helping in a court that's already established to enhance their adult drug court.
All right, Maria, I believe you do have the information on the
Yes,
previous
thank
question.
you. Thank you, Daryl. It took me just a minute to find it. So the National Initiative, Justice and Mental Health Training and Technical Assistance, there are 5 categories. The first category is training and technical assistance for justice and mental health collaboration site-based grantees. The second category is TTA for the Connect and Protect Law Enforcement Behavioral Health site-based grantees. The third category is for training and technical assistance to enhance law enforcement services for improved agency operations, policies in response to people with mental health disorders and mental health substance use disorders, supporting state, local, and tribal capacity for jurisdictions in the field. And the fourth category is training and technical assistance for collaborative crisis response and intervention training grantees. And the fifth category is training and technical assistance for Kevin and Avante site-based grantees. I hope that helps.
Great, thanks for that, Maria. Will the Harold Rogers PDMP grant be different this year compared to previous years?
No, it's going to be the same pretty much as it has been in the past.
Can additional COSSAP grants be obtained to fund a successful COSSAP project scheduled to end September 2021?
Yes. Short answer, yes.
And somebody was wanting to put up slide 21 again. This is information on the COSSAP program, resources and training and technical assistance with a link there and some information. I'll just leave that up for a moment as you can jot those information down for that.
I'm sorry I rushed through that slide, but if you find this resource, you'll be able to request free training and technical assistance, but also see when the COSSAP solicitation is released, as well as any successful applications that we awarded in the past will be on this site as well.
This one's regarding the adult drug court program. Their particular adult drug court has completed the planning phase, but is not yet operational. They hope to receive approval to operate in April 2022, next month. They're looking at applying for the FY22 ADC discretionary grant program. Their first docket's May 13th. Would they qualify to apply for Category 2 enhancement funding under that program?
They would probably be looking to apply under Category 1, the planning and implementation. Again, that category is specific to adult drug courts that are, well, not adult drug courts, but courts that are planning to start an adult drug court. So they'd be looking to apply under Category 1.
And if a particular agency has a Connect and Protect award, are they eligible to apply for another within a different county?
So the applicant agency that has a current award would like to apply in another county, if that's what I'm understanding. So it depends on, yes, you can submit another application. You know, absolutely. If it's the same application for the same project from the same community, you know, getting two, maybe not. But if it's a new project in a different community with a different applicant, then yes. I don't know, that was a little bit, I'm not sure if I answered that so well. It's a little bit confusing.
Oh, she did confirm, our person did confirm that did answer it. So thanks for that,
Okay.
Maria.
Okay, sure.
And with that, you know, we're at 3 p.m. Maria, is there anything you and Tim want to say in closing before we wrap up today?
Just thank you to all of our panelists for being on today to answer questions. And a big thank you to our audience and attendees for being a part of the webinar today. Thank you.
Great. So on behalf of the Bureau of Justice Assistance and our panelists, we want to thank you for joining today's webinar. This will end today's presentation.